Thank you. Good afternoon. I am Brooklyn Borough President Eric Adams, and I'm joined here with my colleague in government, public advocate Jemani Williams. And I just really want to just thank Public Advocate Williams for seeing what many people are tending not to see, that we cannot wait until this crisis is over and then have this post-coronavirus review. We must look at the areas where we can right-size the ship now and ensure that we deal with some of these crises on the ground. And I don't quite understand why many believe that we can look in post-coronavirus. There are things we can do now to save lives and minimize some of the lives that we have lost. And Jemani has continually attempted to elevate that conversation, and we believe it's important because we're seeing firsthand what's happening to families that are dealing with coronavirus. And we say it over and over again. The virus does not discriminate, but policies and practices and procedures in the city and state and country continues to discriminate in those communities that are poor and of color. And nothing, we believe, really personifies that more than what is happening in nursing homes. I received a number of calls from nursing home residents who have family members who have reached out to me, and I'm sure the public advocate will talk about that, as we have one very concerned member of a person who is in a nursing home, their family members in a nursing home, and they are concerned about what they have witnessed, and they will speak in a few moments. And they are a representative of the many numbers of calls we have received to our office about what is happening in nursing home facilities. The numbers speak for themselves. Brooklyn has over 40 nursing homes. In New York City, we have over 170 nursing homes. Many of the family members feel as though their loved ones in nursing homes are treated like they're detainees. They can't visit them, they can't see them, they are in solitary confinement. And in many cases, they feel as though that this is traumatizing, and this isolation is going to have a long-term impact on the health of many of the seniors who are in these nursing home facilities. When you think about it, 25% of the COVID-19 deaths in New York City have been nursing home related. As of a few days ago, based on the New York Times report. We want an analysis, as we've asked over and over again, on the ethnicities throughout the entire city. Who are the 25%? Who are they, and where they come from, and how are we addressing this issue in a real way? We knew at the start of COVID-19 that those who will have the most challenging time to cycle out of COVID-19 were those who had pre-existing conditions over the age of 60 and 65, had diabetes, respiratory issues, heart disease. That clearly states nursing homes. And we should have had an immediate plan, not just to cosmetically address this issue, but to address it on the ground. When you look at the perfect storm that's being created, large number of employees of nursing homes are calling out sick. We need to do an analysis of their manpower so that they don't go under minimum manning. In over 2,000 facilities that have been looked at in New York State. There's over 2,000 nursing homes in New York State. When you think about it, this is a substantial number of nursing homes, and this is a substantial number of people who are susceptible to losing their life to coronavirus. We had one facility, nursing home here in Brooklyn, they indicated that they had to convert, it is reported that they had to convert one of their rooms into a makeshift morgue. This needs to be investigated to determine how long were bodies held after they expired. How long was it before families were notified? How long was the medical examiner notified? How long are we keeping bodies? What are the rules and regulations of notification and removal of bodies? We know there's a backlog on the finding locations for bodies after a person loses his or her life, but they can't and they should not be sitting inside a nursing home facility. We cannot have bodies decomposing inside nursing homes, and if this is happening, it needs to be investigated and determined right away how to ensure that this does not happen again, and we don't want to continue to hear reports about this. People are constantly talking about inaccurate information, the lack of communication in nursing home facilities, unable to find out about their loved ones, and it's extremely troubling and traumatic to these family members. In mid-March, the state banned visitors from going into nursing homes and moving away group meals and activities. We need to repurpose the individuals who would normally hold activities in nursing homes and who monitor these group activities. We need to repurpose their assignments to allow video communication via any form of video communication to allow people to see their loved ones. Loved ones should not be placed in a facility where you cannot communicate or see them. And this is what we are demanding to change. We are calling on the State Department of Health to put in an initiative as part of the overall health of those who are in nursing home facilities, that it is required for some form of video surveillance where an individual can see their loved one, communicate with them. That is part of the overall health. Isolation is a health care crisis. And that is one of the byproducts of coronavirus that we cannot ignore. When a patient tests positive for coronavirus in a nursing home, state regulations require that they are isolated in a separate room or facility. But we need to ensure that there's enough testing in our nursing home facilities. We've noticed, as we stated, that the under-testing in Black and brown communities, we believe, has led to some of the spikes that we're witnessing. We need to ensure that we have adequate testing, and those patients who are tested to have coronavirus are treated in a manner where the virus cannot continue to spread, or they're removed from the facility and put in a place that they can receive the necessary medical care. Three things my office is asking is: one, PPEs, a term that we've all become used to, personal protection equipment. We believe that we need to immediately have a surge of equipment in the nursing homes, as well as any other tools that they need. That would include gloves, masks, hospital gowns, any equipment they need to give to that high, dangerous population that can actually lose their life to coronavirus. We want them to have the tools that they need. They are on the front line of the front line because this is a high need population that could have a challenge of cycling out of coronavirus. Second, we're going to be sending off communication to the New York State Attorney General. We want to thank her on a phone call this weekend. She continued to highlight the problems that we need to deal with in nursing homes. We believe, and we're going to ask her to set up a hotline in her office, and we believe she should have the full ability to enter any nursing home with her team with the right protective equipment to do random inspections to see how these patients are being treated while they're in these facilities. And third, we want to require every nursing home in New York City to offer video conferencing services to residents so loved ones can see them. This is truly traumatic that you can't see your loved one while they're in nursing homes facilities. And there needs to be an immediate reporting on what is happening and the standard of care inside the nursing home, so family members will know what is the progression or decline of the physical and emotional condition of their loved one that's in the nursing homes. At this time, I'm going to turn it over to the public advocate. Again, I want to thank him for his determination of highlighting and addressing some of these everyday needs that are disproportionately impacting poor communities, communities of color throughout the state, throughout the city of New York. And then we would turn it over to Jane Doe, who would talk about her personal encounters inside the nursing home facilities. Public advocate.
Thank you so much to the borough president, who I just want to also thank. He's been one of a few voices that have been really pushing back and trying to elevate these issues from the beginning. Before there was even a lot of media coverage, he has been relentless, and I appreciate him for that. I wish there were more folks that would have listened to us earlier on. We actually may have saved some lives. I want to thank Jane Doe for coming forward with the courage to share what her experience is. Sadly, we know and understand we're here now because Jane Doe's experiences are not alone. She is not speaking on behalf of her story alone. She's speaking on behalf of a whole story with a lot of people who are going through some terrible ordeals at this moment in time where we didn't have to. We've gotten calls in my office as well, and some of the worst calls are when you can't do anything. We've gotten calls about bodies being piled up in nursing homes. The calls we got were in Brooklyn. And as we've seen with a lot of these things, these virus didn't create the problems. They are highlighting and exacerbating problems that already exist. We've had complaints about the lack of oversight in nursing homes. We've had complaints like this before. Nothing was done about it. And I do want to add, one of the things that we keep saying is many of these things were foreseeable. None of this is a surprise. The people who are most vulnerable were most vulnerable before the coronavirus came about. And when we look back and do a review of this, there's going to be a few things that we're going to say, probably three. One, we didn't act fast enough. Two, we didn't adapt when we got information. And three, we didn't act boldly enough. And those three things could have really saved lives. And many folks are saying, well, let's wait and then review. In a normal circumstance, that would make sense. The problem is we're making the same mistakes currently. We're still not acting bold enough. We're still not adapting to the information that we're getting, and we're still not acting swiftly enough. These issues are happening today. They're not happening a few weeks ago. The issues we're referring to now are happening right now, and I still don't see the plan to address the most vulnerable among us. And among those groups of folks are the nursing homes. It is not, you don't need rocket science to describe the type of person we have always said would be most vulnerable to this, and not understand that a nursing home where it has the population we're saying can be most harmed in a confined space, not able to leave, would not be the worst case scenario. Yet there was no plan on any level of government to assist these folks. And that's why, as the borough president said, he gave numbers of 25% of people in Brooklyn. In Western New York, we know that over nearly half of the people who were lost are from nursing homes. On Sunday, there were 5,650 corona cases, 340 in New York nursing homes, and 1,979 deaths among nursing home residents. 419 in Brooklyn, 325 419 in Bronx, 325 in Brooklyn, 188 in Manhattan, 531 in Queens, 101 in Staten Island. These are people with real families, their real names. They have people who love them, and they loved people. And I'm not even sure if all of these that we're hearing are accounted for and put into the numbers that we want to see. So I joined the borough president in all the things that he's asking for, the attorney general, the PPE, the telehealth. We also have a senior section in our response and recovery report of what we can do to help our seniors in the population in general. And there are people and things that we never activate. We just didn't activate. We have community boards that could have been activated to put a network of support around so we can stay in touch with our seniors and most vulnerable, including the nursing homes that are in the area. This is a crisis that was preventable. New York State and New York City is among the worst response in the entire world. And that doesn't make any sense. And, you know, we keep hearing people say it's because we are the most dense population. Well, we were the most dense population before. And so what did we do to respond to that, knowing all that information? We have no new information now than we did before the COVID response. And unfortunately, there is a human cost to inaction. There's a human cost to not acting boldly. And there's a human cost to not adapting when you get information. And I am so sorry to the people that are having to deal with this, but I'm going to continue to work with all the leaders who want to lift this up. And lastly, it's not surprising to me when I look at these press conferences on the city, state, and federal level. The people who are speaking and the people who will surround the folks who are speaking are not particularly diverse. They kind of look like one community. And so it may not be surprising that if the voices around you are not diverse, that the people who are hurting the most are the people who are hurting the most. And so while we lift up every socioeconomic status, because everyone is hurting, as we have said, the virus doesn't discriminate. There are groups of people who are hurting the most. There are groups of people who it is hitting the most. And that is a direct result of the disparate policies and the people who put them in place. Thank you.
Thank you. Thank you so much, Public Advocate. We will now hear from Jane Doe, and I'm going to ask those of you from the media to bear with us because her voice would be distorted, so there would be a lapse in her answering. She's concerned, as many of the other family members of nursing home residents. They stated that they're afraid of reprisals in any way or retribution towards their loved ones that are in nursing homes. Jane Doe has been brave enough to share her personal experience, and there will be a slight lapse in hearing her response as the voice is being distorted to protect her family member. But at this time, we will hear Jane Doe tell her personal story of some of the things that she interacted with while in the nursing home facility.
She's 95 years old and in a nursing home. She's lived there for 5.5 years, and she's received relatively good treatment. And there are people who do work in the nursing homes who are what we would call angels, and they do a good job. Of course, you have a group of people who are working there, and that's not a good fit for them. And in addition to, people should take jobs that they care and they love, because to take care of these residents requires a skill and training for these kinds of jobs. It's not an easy job.
Jane Doe, can you tell us how often are you able to physically see your loved one?
Well, it's been a month since I've been able to see her, and part of that is because the communication venue was not set up. Although the nursing home does have a first-rate communication system and computerized system, so this is disingenuous. The bottom line is that if people were to see their beloveds and their relatives, they would see what they're looking like now. And some of them have declined and deteriorated in a month.
Jane Doe, can you tell us about the movement of your loved one? Is she confined to a room? What type of activities? How is her overall movement?
Right now, the residents appear to be just like detainees. They're locked into, they are in their rooms, and there's very little activities because it appears that, from what I understand, that they've been situated in their rooms and their doors are closed. That means if they have a roommate, that's all the communication that they might have. And some of those resident roommates are not that talkative. So they're in isolation and there's very little communication. There's no activities going on because people are not getting service that way. And so this is a very difficult piece to be in isolation, not to see your family members. I don't know how she's eating. I know that I would take some interesting foods for her and drinking, because one of the main issues in the nursing home is rampant dehydration. So these are the things that, and lack of staff, low staffing, and poor ratio, resident ratios to the number of staff members to help, CNAs that they're called. Unmute me.
Jane Doe, can you tell us about the physical condition of your loved one during the time since coronavirus? Has her condition stabilized? Do you see a decline?
Beforehand, she was quite vibrant. Now what I see is she looks lethargic and almost to the point that she might even be on some low-grade drug. So I'm concerned about that because she's become almost like the voiceless and the vulnerable, whereas before she was vibrant. So this has created a real concern.
Jane Doe, we're going to open questions up to the press, but I want to ask you one more question. I recall you sharing that at one time you saw your loved one moved around the facility without any mask or any other personal protection equipment. Can you share that?
One of the problems is that the staff has brought in more of the diseases and cross-contaminated. They've been, and the management has been duplicitous in not making sure that the staff have PPEs. Now, if the staff is coming in from the streets, and they're taking trains and buses and cabs or walking, going to their families, and they don't change their clothes when they get to the job, then they're bringing in the diseases to the residents. Now you denied the families from interfacing with the residents. So it's not the families bringing in the diseases, it's the staff. And we saw when I've seen, or other people around have seen my mom, she did not have on a mask, and some of the other people had on masks. So what does that mean? Does that mean that the residents are not being protected against the staff, the germs and bacteria that they're bringing in?
Okay, unmute me.
Furthermore, my mom looks a little gaunt. She's lost weight, and I'm concerned about that also. And we have to monitor this. I was always what they call an essential visitor, so I was able to monitor her care and monitor her every day, and I knew what was happening with her. Now a month has passed. I'm not able to understand or get an assessment of how she's doing, and we are entitled to that as a family member. All members are entitled to being given an assessment of their residents' health care.
So folks, this is Jonah Allen from the Brooklyn Borough President's Office. We want to thank you for joining us. At this time, we are open to questions from the press. We are going to ask that if you have a question for the borough president or for Jane Doe or for public advocate Jumaane Williams, that you write in the chat and we'll try to get to you. So a question from Justine at New York 1. Good afternoon, Borough President Adams and Public Advocate Williams. What nursing homes were their bodies piling up?
We are asking the Attorney General and the morgue and the Department of Health. We received a couple of locations. We're going to turn that over to them. In no way do we want to anyway hurt the reputation of a nursing home without first having these entities conduct an investigation to determine the accuracy. We received a call from a number of locations, and I want to turn that information over to the proper authorities first so they can do their investigation and then give an official report so that we don't damage the reputation of any institution without it being accurate.
Thank you, and we'll do the same. We did have several calls. One of them actually, it was about 9 bodies that remained there for some time. We are told now that the mechanisms were put in place for them to be picked up, so we're going to be verifying that, and we'll send that information over as well.
We have another question from CBS 2. What nursing home is Jane Doe's family member in, or if not the specific nursing home, just the neighborhood or area?
The Jane Doe's family is in a nursing home in the Flatbush Crown Heights section of Brooklyn.
With regards to nursing homes, do you think nursing homes should be telling loved ones how many COVID cases and COVID deaths they have?
I believe that it's imperative that nursing homes share with family members, number one, what are they doing with positive diagnosis of COVID patients with floors? Are they sharing the same floors? I think the information of the number of deaths, we don't want to cause panic to facilities. I believe what's most important for the nursing homes to share with the family members that they're taking every proper precaution not to allow the spreading of COVID-19 inside a nursing home facility, and give the family members an option. Do they want to relocate their family member or not? But it's imperative that the right steps are being taken to ensure that those who are diagnosed with COVID-19 are treated appropriately and isolated from others. But it's also important, as Jane Doe stated, that those who are employees are changing their clothing when they enter the facility. There are things that should be done so you're not bringing in COVID-19 into an isolated facility such as a nursing home. Public advocate, anything you want to add?
And before I turn it over to the public advocate, this is Jonah again from the Borough President's Office. You can either write your questions, members of the press, into the group chat, or alternatively, you can raise your hand and we'll unmute you.
Thank you, and I agree, and I want to add that, you know, for myself, and I know for the Borough President as well, a lot of times, you know, the communities we represented, the communities we're trying to hold up, it's not just neighbors, constituents, it's also family. And so I have my aunt who for a number of weeks was unable to see my uncle before they started trying to figure out some abilities to do some telecommunication. And I bring that up because I want to make sure that we're remembering that we need the best case scenario, not just for the person who's in the nursing home, but for the family. And so oftentimes they're elderly as well. The added trauma of not being able to even see a loved one to understand what's going on. There's an entire family that's hurting. And when you get down, you may go into depression, that further makes you susceptible to illness. So there's a cascading effect that can happen here. And I agree with what the Borough President said about what the nursing homes should or shouldn't do. I just would add the most important thing is for them to do something. And I feel like many times there was not a plan put in place that was shared with the families of the loved ones who were there. And that lack of communication can be the most devastating thing. And on the government side, there should have been guidance for these nursing homes. They should have given them a plan of what we are going to do for the nursing homes. Since if you were to describe in a facility or a place where would be the most and harshest impact, it would probably be nursing homes that are filled with our elderly and our senior residents, many of whom may also have underlying conditions. Yet that was ignored. And to some extent, it is being ignored right now. We're hoping as we continue to shine a spotlight, that our leaders will act, will respond. We don't have the luxury of time for responding to this. I have about 65, 70 staff members. I believe the borough president has similar, and we're doing the best we can with the staff that we have. But our mayor and our governor has thousands to tens of thousands of folks. We need to make sure we are breaking up our resources to focus on the areas that need it the most. And right now we're failing as far as that is concerned.
Jane Doe also would like to respond to that question as well.
There are a lot of points I haven't been able to make. One, the administrators are very important in making the decisions for the residents. And a lot of them are not doing that. They're doing things that's convenient to them. And one of the things that we have to look at is there's a three-pronged piece. There was an unpreparedness, there was no proactive thoughts, and now we're in an emergency. There's no critical analysis that's been put in place. There is no understanding of the risks analysis and no root causes of an analysis for things that are going on now. We are now looking at residents who have not been given any medical updates so the families know what's going on with them, and that is an imperative. The doctors are not calling because the doctors are also stressed out and they have multiple other concerns. But this is dangerous for the families. Family members don't know if their loved ones or the residents are still alive or not. There's supposed to be an update. There are special laws to protect the residents, and these laws are not being adhered to. And there's so many things that are happening. Some of the patients have monies that are turned over to the nursing homes every month. If they're sickly or their family members don't know about it, there's money that's being accumulated. Are the family members on top of that? So there are legal, financial, medical, and emotional, social concerns that the residents they're not being represented properly, and we have to look at the family members must go to the nursing homes and check in and check on their relatives. This is unacceptable behavior, and we must save our seniors. This whole idea of letting our seniors go or sacrifice is inhumane, it's amoral, and immoral. It's acceptable on any terms.
The final question is going to come from New York 1, Justine. Going to let the borough president answer, and Jane Doe, if she wants to offer other thoughts. What is the current protocol in place for Jane Doe to get updates on her family? How often is she getting updates? I understand about a month ago, Jane Doe was considered an essential visitor, and now she cannot see her family member.
Yes, and that is part of the problem that Jane Doe and other Jane Does in the city and borough have reported to us that their family members appear to be in some form of punitive segregation. You can't communicate with them, you can't get updates, the lack of communication, the lack of the ability just to find out the status of their loved ones. That is why we believe the Department of Health must introduce into the everyday healthcare procedures some form of televideo conferencing, so people could physically see their loved ones and really give some clarity on how often a loved one should be updated on the status of their family member. I think nothing was more essential pre-COVID virus than having that family member visit and be part of the overall emotional and psychological care. We have taken that away, and how do we not understand that that would impact on the ability of someone to heal? And I believe that is what Jane Doe and John Doe are all saying the same thing in unison, that they're seeing a physical decline in their loved one. The numbers speak for themselves. A quarter of the deaths are in nursing homes, and I think that one's immune system and not having a loved one there to give them the support, you can only imagine the feeling that you are on 24-hour lockdown with no interaction. We have reversed doing that in prisons, so why do we still have it in place in our nursing homes? And we are now also allow Jane Doe to also respond to that question.
In the team approach, not only is the home, the nursing home, the place for care, but there's a team, the clinicians, the administrator, CNAs, the security for safety, and the family. That's the triad. And the family is necessary for love and compassion. And we know how important love and touch is. What we're now seeing is the decline of the resident because of there's no interfacing from their loved ones, no touch, no compassion, and the way that the staff is being overworked. They can't do this anymore. At least when the family members came, there was a support system in place, and they could undergird the CNAs and the other staff members. That can't happen now. What are people thinking? That they've been abandoned? And this isolation, this is the worst part. And depression sets in. How can we allow our seniors to go through this? They're in the last quartile of their life. This is not fair. This is not right. This is draconian, and we could do better. The mess that we've created here is lack of compassion, lack of humanity, and America's onslaught of cruelty being imposed on our most important demographics, our seniors.
Thank you again, Jane Doe, and we're going to turn over to the public advocate. But we want to be clear, in any type of operation, you have a rescue phase till you go to a recovery phase. I don't want to prematurely go to the recovery phase. We're still at the rescue phase. There must be a plan for intervention and prevention. We have seen a focus on intervention in the hospital, in the emergency rooms, but we must match that with a plan for prevention. We must prevent the premature deaths in our nursing homes, around our senior population, among our high needs population, among those with pre-existing conditions. If we don't match those plans together and prematurely move into the recovery phase, we're stating we have given up and there will be casualties. And I say no to that. We must move into a dual phase to fight coronavirus and get on the ground. And that is how we address this issue of coronavirus. And again, I want to turn it over to the public advocate who has really been a leading voice on this. And I want to again thank him for his partnership in many of these issues that we're bringing to the forefront so we can save lives. Public advocate.
Thank you, and thank you to the Borough President, who again has been one of the few voices that have really been pushing and cutting through all the politics of it and getting right to the point, which is what we need right now. And I kind of want to echo that we don't jump to recovery too soon. LA County just put up a metrics yesterday, and we should listen to them. They've been ahead of us in so many of these things that actually talk about what could happen if we begin to change some of the things we've been doing, if we tighten it, and if we begin to release it. And the worst case scenario is to begin to release what we've been doing, because we'll see we'll see too much casualties based on that. So we can't rush into recovery. My just closing is to, again, really push our leaders. Yesterday, the entire world saw the president's refusal to accept that he could have done anything differently. As a matter of fact, he was trying to act as if everything he did was helpful. And I'm just asking our local leaders to be different kind of leaders. And in order to do that true leadership, you say, here's where we messed up and here's where we're going to do better. It's hard to even get to that second step if there's not even an admission that something went wrong. And the reason that is important is I feel as if we're making the same mistakes today as we did several weeks ago, particularly in not putting forth a plan, particularly not making it a priority for some of these most vulnerable. So I, as the borough president has in the past, I'm thankful for what the mayor has announced recently to try to address some of these issues. But it's a lot late, and right now it's not enough. It's too little. And so we have to look at the nursing homes, and we have to look at the most vulnerable among us, and we have to put a plan in place today. Time is not a luxury that we have. It was a human cost to inaction, not by days and weeks, but by hours. And so we have to get a handle on what's going on in these nursing homes before we lose more people and before more families have to mourn. So if we're going to get up in front of the cameras and give press conferences every day, we should be able to honestly tell the public that we're doing all that we can. Right now, that's not true, and it is unfair to the residents of New York City, and in fact, the residents of New York State. So let's please protect some of the population that we all care about, we elevate. That's our seniors. Those are the folks that help pave the way for us. We wouldn't be here without that population. These are supposed to be the best years of their lives. We did not put a plan in place to make sure that happened. In fact, we have never put a plan in place. And now this virus is exacerbating, putting a highlight, magnifying the differences in this city, the two-tier system at least that we have. And we think that there has to be better. We must do better. Thank you.
With that, we want to thank you all for joining us. Just a couple housekeeping items. We will be sending a recording of this meeting out to everyone who joined us and the remainder of the press list. If you need to reach me directly, if you didn't get to ask a question, you can reach me on my cell phone, which is 929-291-8881, or my email, which is jonah.allon@brooklynbp.nyc.gov. So thank you all for joining.